might be wondering how to convince your doctor you need weight loss surgery. All right, we're gonna go through it coming up next. In this video, I'm going to talk about the different kinds of weight loss surgery available to you. Then I'll tell you why weight loss surgery isn't the only option you have left, even if you've failed at everything else. Finally, I'll reveal a weight loss option you may not have thought of yet that doesn't require surgery. There are 6 different types of weight loss surgery. Gastric lap band. The surgeon laparoscopically wraps a band around the top of your stomach, essentially creating a new, smaller stomach that can handle a smaller volume of food. Next, we have the gastric sleeve. A sleeve is inserted into your body and stapled to your esophagus and your intestines. It basically replaces your stomach and it reduces the volume of food you can take in. Then we have gastric bypass surgery. There are several different versions of this surgery, but essentially a surgeon takes part of your stomach and uses it to make a new kind of a baby stomach, and then reroutes the new baby stomach to reconnect to your intestines. Next, we have a gastric balloon. A special balloon is inserted into your stomach and inflated. It reduces your stomach capacity without cutting up and stapling your stomach and intestines. Biliopancreatic diversion bypass surgery. It's the same idea as gastric bypass, but a different amount of your stomach is portioned off to create a smaller stomach. And it's rerouted to your intestines just a little differently. Aspire, assist, and vagal blocking. A tube is inserted into your stomach and sticks outside of your body. You eat, you wait 30 minutes, and then you go to the bathroom, hook up a device, and pump out the food you just ate. If you get weight loss surgery, will you lose weight? Initially, yes. The amount of weight loss depends on the person and which procedure you get. The average is 5 to 15 pounds per week during the first 30 days after surgery. Men tend to lose a little faster than women. But what happens next is weight loss typically slows down or stops altogether. Then the regain kicks in. It's rare that a bariatric patient actually reaches their goal. And you know why? Because they go back to their old foods. Even though it's harder now, because their insides have been altered, they get creative and they find ways to make it happen. I once talked to a client who lost a ton of weight with gastric surgery, but then gained it all back just by sipping sweet tea all day long. What you've got to understand is that the weight loss surgery is not a magic pill. You'll have to follow a set of rules for the rest of your life. You will never get to have your cake and eat it too. Each of these types of weight loss surgeries come with their own set of rules and problems. Here are the most common things that can happen after weight loss surgery and problems that really no one wants to talk about. All the websites make you want to think that it's just roses and rainbows after surgery, but let me tell you, it's not. There are real and long-term side effects that you need to be aware of. My sister Carrie is an RN, and she also got bariatric surgery. She's either seen or experienced these firsthand. There's a risk of repeat surgeries. I mean, my sister has had 3. Plus, you could also experience constant throwing up. I'm talking daily. Anemia, chronic B vitamin issues, malnutrition. You might experience digestive issues. Some people never poop the same again. Then there's dumping syndrome, gallstones, bowel obstructions, ulcers, and acid reflux. The lap band may slip or cause erosion of your stomach tissue. The staples on your stomach may leak after surgery, and you may feel like throwing up after you eat. Weight loss surgery does not address the root cause of why you have a weight problem. When you failed at weight loss 1,000,000 times, I see why you think the weight loss surgery is your only hope. But the things contributing to your weight problem, they don't go away just because you had weight loss surgery. Sugar addiction doesn't go away because you've had the weight loss surgery. Self-sabotage doesn't magically stop just because you've had your insides altered by weight loss surgery. Let me stop here real fast and ask you to comment below and tell me, what is your experience with bariatric surgery? A third of our Code Red clients come to us after failed weight loss surgery. So do you have any experience with this, or do you have a loved one who has had experience? Comment below. I want to hear your story. My sister Carrie was 260, 270 pounds, but she wasn't big enough to have weight loss surgery in the United States. So she took off and she went down to Mexico. She didn't tell any of us that she was doing this. Like, none of us knew. I think only her husband knew. She didn't tell me or my mom. I mean, I'm her best friend and she didn't tell me. She was full of such shame about having to go get weight loss surgery. Well, there were problems with her surgery, and she has had to have many follow-up surgeries that have left her with lifelong problems, issues that will never go away. She didn't know back then that there was another way. I mean, none of us really knew about Code Red back then. She gained her weight back, and it was only until she found Code Red that she lost over 100 pounds and has kept it off for many years, almost a decade now. Like I mentioned, a third of our Code Red clients have had failed weight loss surgery. This is something we talk about on our 10-pound takedown challenge. We actually have a teaching on one of the days. I have a teaching every day for 30 days, and one of them is the shame of weight loss surgery. And I've done a lot of videos about weight loss surgery because there is so much shame associated with this. And I want to tell you, can I just say that you're in good company? Can I just say that we love you? And we don't care that you have gained your weight back. We don't care that you found the workaround. We don't care that it didn't work for you or that you gained your weight back or you never reached goal weight. We don't care what your situation is. We love you and we want to help you and we will help you. But let me also say that if you come to us, we're on to you, okay? If my sister Carrie had failed weight loss surgery, she failed it because she found the workaround. She failed because, the surgery was unsuccessful, but she didn't follow the rules. And we know what happens when people don't follow the rules. So if you come to Code Red, you can't try to say, I tell you what, I can't drink the water. I can't do that. I can't do this. I can't do that. Listen, we understand what you can and can't do. We completely understand what you're up against. We know your limitations. Carrie's got the medical training and, of course, the experience to handle this. And one of our coaches, Lisa Kane, had failed bariatric surgery. So we understand. We get what you might try to pull on us, but I'm not going to let you pull anything over on us. You can do this. I'm going to hold your feet to the fire. You're just going to have to do things in a little different way than someone with a normal stomach does, okay? But you're not getting out of the rules. We're just going to tweak a few things for you. Understand before you come that you cannot argue your way out of the rules. You're going to be able to do this. We can get you to goal weight. We can get you healthy again. So what's the appeal of weight loss surgery? I mean, the name of the video is how to talk to your doctor about weight loss surgery. Why do people, or why are you thinking about this? Why did you click on this video? I get it that it's appealing because you're losing so much weight so quick. But did you know that Code Red Rebels can actually lose just as much weight as bariatric patients? I know that is hard to understand, but even without the surgery, you can lose weight with real food, water, and sleep. And you feel hopeless. You feel like this is your last resort. I don't want to say anything bad against medical doctors. These weight loss clinics, these doctors, these bariatric doctors, they're there to make money. All right, there's no money in healthy people. There's money in surgeries. There's money in people who need to have this surgery, and they're moving them in, moving them out. They will tell you legally what they have to tell you as far as risks goes. But nobody really tells you the little things. Nobody tells you all of the things that could possibly happen. Their job is to get you in and have the surgery. And there are good things that can happen when you lose weight. Of course, whether you lose weight this way or you lose weight my way, there are good things that can happen, but there are so many complications that can happen that I think that, people just don't quite understand. They're not really made to understand like they should before going into this. And you know what? It's sometimes you don't know any other way. You just have never heard of real food, water, and sleep working as well as bariatric surgery. So you don't know the other options. And I am telling you, I am begging you to take the chance on this one more option. Just give me 30 days. Give me 30 days. Go ahead and schedule your bariatric surgery for 30 days from now. Do my challenge. Start with the 10-pound takedown. Give me 30 days to prove to you that I can get just as much weight off of you without the surgery, and you can start healing your body. When you start to heal your body, lots of things happen. Yes, the weight comes off, which is in our society, we're so focused on the weight. But other things happen. You can reduce your medication. You possibly could get off your CPAP. You can reduce the pain in your hands and your knees, reduce your plantar fasciitis pain. Your confidence goes up. Your hair and your nails grow thicker and longer. Your vision actually improves. Your energy goes up. Everything gets better when you start to heal your body with real food, water, and sleep. So I am just asking you, please, just give me 30 days to prove to you that the Code Red lifestyle is a better alternative to what you're considering having done. If you want to lose weight, let me share an alternative to weight loss surgery. Give the Code Red lifestyle a shot. For many people, Code Red was their last stop before surgery, and it worked. Lots of these surgery complications are real, and not a lot of people want to talk about them. You can avoid these complications. You can avoid expensive lifetime shakes and vitamins. You can avoid digestive issues. You can avoid permanently altering your organs. I encourage you to download the Code Red app by going to coderedlifestyle.com/app. It's going to be a one-stop shop for you, so get on the app. That way you can stay off social media, and I'll see you on the next video. There are 6 different types of weight loss surgery. Gastric lap band. Okay. It reduces your stomach's She has had many follow-up surgeries. Shoot, let me do that again. But let me also say that if you come to us, we know what you're gonna maybe try to do. No, let me start that over. When you start to heal your body, other things happen. Oh, I got an itch. To what you are considering having done. Darn it. I got an itch. Oh, there we go.